Let's be real. Trying to figure out the American healthcare system can feel like you're walking through a maze completely blindfolded, right? It is so complex, it's confusing, and man, it is expensive. But what if you had a map? Okay, let's dive into this and see how you can actually get some of that control back.
So get this, every single year, Americans pay over $500 billion out of pocket for healthcare. And that's not even counting what we're already paying for insurance premiums. It's just a massive, staggering number. And honestly, it can make you feel like you have no power at all.
But here's the good news, and there is good news. While we can't control the whole system, a really meaningful chunk of that cost comes from some pretty common and, more importantly, controllable missteps. And that means you have the power to make smarter decisions that can save you, literally, a lot of money. So where is all this money going? Well, it turns out a lot of it just gets lost in a few common traps, the kind of traps most of us fall into without even realizing it's happening.
Okay, first up, there's choosing the wrong level of care. You know, like rushing to the ER when an urgent care clinic would have been just as safe, but way, way cheaper. Second, there's this wild price variation, where the same exact procedure can cost thousands more at one hospital versus another one just down the street, even when they're both in your network. And finally, there are billing errors, which, as we'll see, happen way more often than you'd think.
So knowing these traps exist is one thing, right? But how do you actually avoid them when you're stressed out, maybe you're not feeling well, and you just need to get care?
Well, this is where a tool that's designed specifically for this maze comes into play. Let's take a look at the CareRoute app, which is basically built to be your personal navigator through this whole complicated system.
At its heart, the app is designed to give you exactly what you need in that moment. Just clear, simple answers to the most important questions. What should I do? Where should I go? And what's this probably going to cost me? You know, the biggest savings often happen before you even walk into a doctor's office. So let's see how this works. We're going to focus on the proactive steps you can take. It all starts with a feature called Smart Triage. So in about 3 minutes, the app asks you about your symptoms and then guides you to the right level of care, whether that's the ER, an urgent care clinic, your regular doctor, or maybe just some self-care at home.
Now, this is really important because it's all about trust. This isn't just some random symptom checker you find online. The app's triage system has been rigorously tested using standardized clinical case studies, and it's shown 100% safety for emergency situations. That means you can actually rely on what it's telling you.
And the impact is, wow. Just look at this slide. Take these super common scenarios. If you have UTI symptoms and you just default to the ER, you could be looking at a $1,500 bill. But if the CareRoute app points you to urgent care, that cost plummets to about $150. That's a savings of $1,350. Same deal for an ankle sprain. A simple, informed choice saves you over $1,000. It's incredible.
Okay, but what if you do need a hospital? You'd think that as long as you stay in-network, all the options are priced about the same, right? Nope, wrong. Prices for the exact same visit can vary by as much as 4 times, even among hospitals that your insurance plan fully covers.
Just look at this example right here. A simple overnight stay. Both Hospital A and Hospital B are in the same network. But just by choosing Hospital B, you save $1,300. Without a tool showing you this hidden difference, you're basically just guessing and hoping for the best.
And it's not just for hospital stays. This applies to all sorts of common procedures. Getting a colonoscopy at a specialized surgery center instead of the hospital could save you $700. An MRI? You could save $1,000 just by going to a dedicated imaging center instead of the hospital. The app brings all these lower-cost, in-network options right to the surface for you. So you've made all of these smart choices before your visit.
Awesome. But what about when the bill actually shows up in the mail? Well, the chance to save doesn't end there. In fact, for a lot of people, this is where the real fight begins.
Are you ready for this number? A shocking 80% of medical bills contain errors. 80%! I mean, that is just wild. It means there's a huge chance you're being overcharged, and you probably wouldn't even know it.
This is where CareRoute's Bill Defense service comes in. You just upload your bill, and their team of experts gets to work for you. They hunt down those errors, they see if you qualify for any financial assistance programs, and they negotiate directly with the provider to get that total amount down.
And here's the best part. It is completely risk-free. You only pay a fee if they actually save you money. If they can't find any savings, you don't pay a dime. It's a no-brainer.
So when you put all of this together, what's really happening is a shift in the power dynamic. It's about moving from being a passive patient to becoming an informed consumer who is finally back in control of their own healthcare journey.
And the real-world result? Well, for a typical user, making these smarter choices, both before and after care, can easily lead to over $1,000 in annual savings. For so many families, that is a truly meaningful amount of money.
And look, this isn't just theory. Real users are seeing these benefits, like HQ here, who said, "It works. It identified my issue, suggested 3 nearby options, and estimated my costs. Great app." It's that kind of simple, direct value that really makes the difference.
So really the key takeaway is that you now have a toolkit. You've got a way to know the right level of care to seek, you have a map to find the lowest cost providers in your network, and you have a defense team to fight and reduce your bills after the fact.